On the Medical Watch, they're suffering the same injuries that plague the pros, but they're only teenagers. A local orthopedic surgeon says it's a dangerous trend in youth sports.
You kind of just have to block everything out. It's just you and the catcher. Your mindset should be this pitch. Focus on right now.
This was Maggie Carpenter's first day back on the mound. It had been 7 months since the 16-year-old last threw a pitch, but it was an overhand throw that ultimately knocked her out of the game.
I was warming up and throwing overhand from the outfield, and I felt a snap in my elbow, and then that's when I knew like something wasn't right at all. I knew that it was bad.
This is Maggie's elbow MRI scan. And
an MRI showed a torn ulnar collateral ligament in her elbow, an injury more commonly associated with major league pitchers. The reconstruction is called Tommy John surgery, named for the first baseball player who had it to save his career.
This problem is really based on two factors. Number one is the amount that you throw, and number two is how hard you throw.
I didn't really even know what Tommy John surgery was until I was told I needed it.
Maggie first felt pain in her elbow 2 years ago.
The ligament was under stress for a long period of time, was probably undergoing some micro trauma, which means that there were some small intrasubstance tears, but was still functioning. And then that final throw is what finished it off and caused the complete tear. If you go back 10 or 15 years ago, to have to do this operation in a 15-year-old girl would have been unheard of. This is a new problem that's in large part related to what we would consider overuse or single sport specialization.
It's a good one.
Maggie's been playing softball since age 7.
The more she played, the more she loved it. We would practice at least 3 days a week with the team, 6 to 8 hours a week, on top of pitching lessons, hitting lessons, and then tournaments. There wasn't a lot of rest time because she basically played 12 months out of the year.
And then we use some tunnels that we drill in the bone.
It's a trend. Orthopedic surgeon and Chicago White Sox team physician Dr. Nikhil Verma is deeply concerned about.
It's being driven by industry and business. It's being driven by performance centers and weighted ball programs and travel teams. And that's what's happening in these young kids on a travel team level, is you've got to have enough kids playing in order to develop the handful of kids that are going to play in college, and then from there the handful of kids that are going to play in the professional level. The system is flawed, unfortunately. It's being driven by interests that are outside the health and well-being of our kids. There's no data to say that single sport specialization early in life results in better performance later in life. Really, they should be spending 3 to 4 months a year either playing another sport or just doing physical conditioning and workout type activities, but get away from the field.
I probably should have taken advantage of icing my arm more often, or taking rest days and just letting my body heal. It's definitely helped me become mentally tougher throughout the game. I think that it's definitely been a life-changing experience.
Maggie's back now on her travel team and hopes to fulfill her dream of playing in college. This weekend, she threw a no-hitter, but she says she has a new perspective when it comes to listening to her body.